Hello, my name is Lexi, and my presentation is on peripheral intravenous catheter insertions. The purpose of this presentation is to explore whether the use of IVs is necessary, and if so, how to prevent nosocomial infections in the facility. IVs is one of the most used invasive procedures that is done in the hospital setting. Evidence-based practice has shown that IVs can be used for multiple things. In the beginning, drawing off labs in order to get a baseline of where the patient's health is, and also for medication administration, fluids, blood, and a number of other things. Research has shown by a study that was done in Australia that a lot of IVs may not necessarily be needed. A research study done in Australia had a 12-day pre-intervention and a 12.5-day post-intervention in a level 3 emergency department. After the 10-week intervention that was implemented, it was shown that 50% of the IVs that were placed had not even been used. So the results showed after the intervention was implemented a 9.8 reduction in the IVs that are being placed and a 12.9% increase in the IVs that had been placed being used. The intervention made the staff think more critically prior to placing IVs as to whether the patient actually needed an IV, and it also was good in determining whether this was a requirement or not. Another study done in a university hospital of Hamburg in Germany, another level 3 hospital, was about nosocomial infections. When placing these IVs, what steps are needed in order to prevent that? After these elements, a teaching session, a dummy training session on how to insert the IVs, e-learning, and also the checklist, and then feedback from the study nurse to the healthcare workers, the results had showed that over 200 attempts were made in 4 different departments. And in these departments, it showed that the nurses and the staff expressed higher awareness of what they were doing prior to them placing IVs in patients. So the compliance overall improved, which is a good thing because the safety of the patient is primary. The third case was another study about whether IVs were necessary, and this was also done in an emergency department. When the IVs were placed, a lot of them were not being used. After the research was done, it was shown that all of these IVs were not necessary, but there was not a big change. However, the number of IV insertions initiated by nurses, they still had reduced significantly compared to previously. So whether they were being used or not may not have changed, but the placement of them was being reduced. But it was important to them to implement this because they did not want to continue placing IVs just because. So there's been research that has proven that there is a lot of placement of IVs, and you have to take specific steps in placing these IVs to prevent infection. However, although there are studies that may agree or disagree on which devices to use, it is always most important to have safety of the patient and to prevent any infections using certain steps. But if you don't need them, just don't use the IVs. So in conclusion, inserting IVs can be reduced when you critically think and promote clinical appropriate approaches during IV insertions and use. When we are using these approaches, no IV should be placed just because, but each IV should be used for a purpose, with a purpose. And also a bonus, if we don't just place all these random IVs, it could reduce cost as well. Thank you very much.